human epidermis protein HE4. So HE4 is the product of the WFDC2 HE4 gene and is overexpressed in patients with ovarian carcinoma. Peak et al. Investigated the prognostic significance of HE4 in 45 women with ovarian cancer, and the elevated serum HE4 level correlated with the advanced stage. So HE4 are associated with the advanced stage and serous histology. So median progression-free survival for women with the elevated HE4 was 20 months as compared to 24 months for women with normal HE4. Second is risk of ovarian malignancy algorithm ROCA, CA125 and HE4. ROMA, not RO. First we saw ROCA. So in ROCA there was transvaginal ultrasound plus CA125. Then second is HE4. HE4 is elevated in case of advanced epithelial ovarian cancer and serous histology. And now third is ROMA. In ROMA we will see CA125 plus HE4. So ROMA, that is risk of ovarian malignancy algorithm, CA125 and HE4. Test uses the two serum biomarkers, detects ovarian cancer, CA125 and HE4. ROMA, CA125 and HE4. And this diagnosis, the test should not be confused with the ROCA discussed previously. So in a prospective study, 472 patients with a pelvic mass reported 383 women were diagnosed with a benign disease and 89 women were found to have cancer. So diagnostic calculator had sensitivity of 93.8% detecting ovarian cancer. So ROMA CA125 plus HE4 was FDA approved in 2011 like ova1, and it should not be used for the pre-operative evaluation triage of a woman with a pelvic mass and not ovarian cancer screening. And there has been no head-to-head comparison between the two tests. Therefore, it is not known whether one or the other is superior. So ova1 and 2, they were first blood test approved by FDA for triage of the adnexal mass. It is a multivariate index evaluated the following biomarkers like CA125 typically increase in high-grade serous ovarian cancer, and apolipoprotein A1 which is decreased in ovarian cancer, beta-2 microglobulin increased in ovarian cancer, and transferrin is decreased in ovarian cancer, and pre-albumin also decreased in ovarian cancer. So ova1 and ova2. In ova1 there are 5 biomarkers. CA125 which is increased as we shown before, and A1 is decreased in ovarian cancer, beta-2 microglobulin increased in ovarian cancer, transferrin decreased in ovarian cancer, and pre-albumin also decreased in ovarian cancer. So two things are elevated, CA125 and beta-2 microglobulin. Apolipoprotein A1, transferrin and pre-albumin, they are decreased in ovarian cancer. And important attributes to this blood test include the ability to identify different types. So till now we have seen that only the CA125 and HE4 they are elevated in case of high-grade serous cancer, but not other types. So different types of ovarian cancer, it identified ability to identify different types of ovarian cancer, not only serous. So it also performs well in the detection of both early and advanced stage. So not only serous type, it detects other types and also early and advanced stage of ovarian cancer, and it may identify non-ovarian cancer. It provides composite score that can be interpreted depending on the menopausal status, then patient scale 0 to 10, 1 to 10. An abnormal score for the premenopausal woman is more than 5. If the score is more than 5 for premenopausal, that is abnormal, and whereas an abnormal score of more than 4.4 for postmenopausal woman. For premenopausal, abnormal score is more than 5, and for postmenopausal woman, the abnormal score is more than 4.4. The blood test was developed only for the triage of patients with a pelvic mass who need undergo surgery. ova1 was not approved for the use as a screening test, and ova1 test has been shown to outperform CA125 testing clinical assessment of the pelvic mass performed by a gynecologist. And in a study of 500 patients of pelvic mass reported that the combination of the blood test plus physical examination assessment identified cancer missed by physician assessment alone, and also detected 76% of the cancer missed by CA125 alone. So Brislow et al. Conducted a prospective multi-institutional trial designed to validate the effectiveness of the ova1 in identifying ovarian malignancy compared with the clinical assessment. CA125 testing among women undergoing surgery for adnexal mass. And in this study, we identified that 494 patients, the study reported ova1 demonstrated a higher sensitivity of 95% and a negative predictive value of 98% than clinical impression and CA125 testing. So most recently, algorithm was optimized to increase the specificity by substituting FSH and HE4 for beta-2 microglobulin, substituting two things, FSH and HE4 to beta-2 microglobulin and prealbumin. So as we saw in ova1, there were 5 things: CA125, then beta-2 microglobulin, apolipoprotein A1, transferrin, and one more thing, prealbumin. So in ova2, it was the prealbumin and the FSH and HE4 for they were substituted for beta-2 microglobulin and prealbumin, and CA125 to apolipoprotein A1, transferrin, they remain in this second generation, that is ova2 or overa. So ova2 uses a single cutoff point of 5, does not require physicians to determine the menopausal status of the patient. So there is only one cutoff, that is 5 for ova2, that is overa. And ova2 was cleared by FDA in March 2026.